My name is Jerry Boucher. I'm from Bradenton, Florida, 55 years old, and love living here. It's a beautiful life. I'm very active around the house, very active, whether it's construction, building things, tinkering around. Anything that needs to be done, I try to do it myself or read up on it. And slowly I found that I was in some pain in my legs. And if I tried to push myself, it would ache more and more and more, worse than any Charlie horse you've ever had in your life. And if I didn't sit down soon, it would get numb. And then I would actually just fall. I would always have to know where a chair is, where there is somewhere to sit. And you live differently because you're always looking for that next bench. So when I went back to my doctor, he suggested that I go see Dr. Patel.
My name is Ashwin Patel. I am a spine surgeon in Sarasota, Florida, and I work primarily out of Sarasota Memorial Hospital. So Jerry was a gentleman I've known for a while. He's a property manager, so he has to walk quite a bit from one property to other. His problem was frame lordosis in the upper lumbar spine, which affects the quadricep muscle. So he'd be walking and all of a sudden the knee would give out or buckle and he would fall or had a sense he was going to fall. So it was difficult for him. Mr. Boucher had multiple non-surgical treatment, but ultimately it came down to the symptoms just recurring each time after shots and therapy. So he really was forced to have the surgery because he could no longer perform his job as a property manager. I had to put multiple screws because I did a multi-level fusion. It was a 3-level fusion. So I thought that for a 3-level fusion and a guy who's had previous laminectomy where the landmarks wouldn't be as great or as visible because I've done a previous laminectomy, it would be an ideal case. So that was, the expectation was that the robotic system would help me achieve those goals.
He seemed excited that I was a good candidate for what he had called this surgery. That he could use a robot. He assured me that he thought this would be the best operation for me to have. He had said that it would be less invasive, recovery time would be quicker.
We used the Excelsius GPS system in Jerry's surgery, and it worked very well. The screws are perfectly placed, so I'm very happy with the way it worked.
I know nothing about robotic surgery. I know that I trusted Dr. Patel, and if he knows how to drive that car, then he's the driver. Yeah, I was pretty excited that something that they believed in could be something that would help me.
With Jerry's post-op x-rays, his x-rays look perfect in my opinion in terms of his screw placement. He's now able to walk without giving away episodes of his knee and buckling of his knee, and his thigh symptoms have gradually improved, and overall his back pain has improved as well.
Right away, I'm pleasantly surprised that I'm able to walk and do my job. Do a property inspection or go with my family and walk without stopping, walking from a parking lot to some business. I'm happy to walk through a grocery store and not have to stop and sit. And I said, wow, I didn't have to sit down, and you forget what is supposed to be normal.